here we have a status summary for you all to look at this before you see your patient. And one thing on the status report you'll see is this information at the top, it does not change. It will always stay the same, except for those two, the fields I was telling you about, surgery type and impairment. Other than that, this is going to stay the same. But every time a patient takes a status assessment or survey, it's going to give you the date and the score. So that way you can keep track of your patient's episode and see how they're improving, and you have it documented. We have down here with the graph that every time a patient takes a status, it will give you a date and a plot point. So again, you can visually see how your patient's improving through their episode of care. But we'll also give you the functional staging of where our patient is at on the current status you're reviewing. In this case, our patient has already reached a stage 3. If we look down here, what we have here is the patient's functional status score. And down here with the predicted values, then it'll have the date and the points of change that they have made. So in this case, our patient has reached the points of change. And then you can keep track of the visits and the duration in days. And then down here, what we also have, you'll see the intake and then the questions that were asked on the current status you are reviewing. And then you can follow up prescription medication. You can see where they are at as far as taking prescription medication. All right, I think I'm through.